Earlier today, footballer Christian Eriksen collapsed on the pitch, leading to one of the most concerning and scary scenes that we've seen in recent sports history from a medical standpoint. Welcome back, everybody. I'm Dr. Brian Suter, and on this channel, I try to give you a different, more medical perspective on the sports world. And certainly this story is on everybody's mind here today. Most importantly, right off the bat here, we've gotten positive news that Eriksen is awake, having further exams, and has been transported to the hospital and stabilized. There was a picture taken of him coming off the field here where we can thankfully see that he's clearly awake. So at least in the immediate present, things seem to have stabilized and not been kind of worst case scenario. Of course, what was concerning here is the reports that Eriksen received CPR and chest compressions on the field, signifying that there was concern for cardiac arrest, meaning his heart had stopped beating and he wasn't getting blood to his body. Anytime we're evaluating a downed athlete, we have to be thinking about cardiac arrest because that's of course going to be what can be fatal to an athlete. The specific algorithm that we walk through starts with our ABCs. So actually on the field, the first thing we're going to think of is A, airway. Then we move on to breathing. And then the third thing is the circulation. But in basic life support, whenever you come upon somebody who's down, collapsed, whether it's on a soccer pitch or out in public, the first thing you do after checking to see if they're aroused for a few seconds is you check their pulse. With basic life support, if somebody doesn't have a pulse, you try to call for help, and then you start doing CPR, or cardiopulmonary resuscitation, which are chest compressions. Cardiac arrest is essentially when the heart stops beating, and usually this is from an arrhythmia or abnormal electrical activity of the heart. Those arrhythmias can be caused by all kinds of other different things, which I won't speculate on, but the bottom line is the heart stops beating to squeeze blood to the body. So the act of CPR is intended to press on the chest to allow the heart to squeeze to get blood out to the body, and then relax to allow the heart to fill back up with blood. The ultimate thing we're trying to do then is get an AED or an external defibrillator to the person as quickly as possible to apply an electrical charge to try to reset that abnormal heart rhythm, to get the heart beating back correctly. What we have at the end of the stretcher here is probably some type of cardiac monitor that is still actively monitoring his cardiac rhythm, and potentially also these sometimes are delivering a shock to defibrillate if necessary. On the broadcast, there was some thought about, well, did he get hit in the head? What exactly happened here? They were trying to look at the way that Eriksen stumbled and fell and see if they could gain anything from that. And that's where I think the speculation gets a little bit dangerous. With cardiac arrest, the heart is not beating. And so most importantly, you're not getting oxygenated blood that flows to the brain. What that results in is you start to get lightheaded, you get dizzy, and you lose your awareness and your consciousness. And so when we see Eriksen stumble here, likely that's just because he was losing that alertness. He was losing that consciousness because of low blood flow to the brain. And that's really all that this means. Certainly when it comes to what you do ultimately to treat things, it's important to know if the athlete suffered a head injury, if they were displaying any concerning symptoms before this happened. But the exact way that somebody falls, in this case just with low perfusion to the brain, doesn't really mean much beyond that. In the moment in somebody with cardiac arrest, your main priority is trying to restore that normal cardiac rhythm to allow the heart to pump again. Depending on the testing resources you have, as you're doing that, you're going to think through what could have caused the heart to go into cardiac arrest. But this list is very long. Somebody can go into cardiac arrest as a result of many different other organ systems or injuries that don't necessarily stem exactly from the heart itself. That cardiac arrest can sometimes be the downstream effect of some other injury as opposed to directly a problem with the heart itself. And so that's what's next for Eriksen here. Once you get somebody stabilized, resuscitated, and back in the hospital setting, then it's the medical team's job to figure out why this happened. That'll consist of all kinds of different tests and is really where I hope people don't start to speculate because we have no way of knowing just from what we see on the pitch. All that matters right now is that he's awake and that he's stabilized, and over the subsequent days, that's when they're going to do their evaluation to figure out why exactly this happened. There's zero reason to speculate on his future in football or anything else that could have happened here at this time. The medical team did their job to resuscitate him and arguably save his life when it comes to doing CPR and getting that defibrillator on to restore that heart rhythm as soon as possible. Also, before all these sporting events, the medical team goes over their emergency action plan. So they talk with the emergency medical services, the paramedics, they talk with the athletic trainers, the physicians, and they have a plan for these types of events. They know where the defibrillators are. They know how to get the paramedics out there. They plan for this type of stuff. And so far in this situation, it looks like that planning paid off and they were able to save him there on the pitch. And now we just have to find out what exactly happened. But again, all that matters right now is that he's awake, he's at the hospital, stabilized. Thankfully, the best outcome we could hope for after something that was very scary on the field. That's it for the video, everybody. Thankfully, about the best thing we could hope for after seeing what initially unfolded on the field. Let me know, as always, any questions or comments down below. And until next time, we'll see you later.